everyone. Got some exciting topics to talk about today in the grammetry and photogrammetry world. We're here with our very special guest, Dr. Isaac Tawil out of New York. And he's got, again, some exciting news to talk about. And before we go into that, I want to introduce myself. My name is Chris Moore from Rowe Dental Laboratory. So why are we all here today? Well, it's a brand new technology, and this is a groundbreaking technology in the photogrammetry world, and specifically intraoral photogrammetry. And that's a new phrase to come out with this scanner, which is from Shining3D, and it's called the Elite. Now, Shining3D they have a whole suite of products, from intraoral scanners to desktop scanners to 3D printers and clean cure machines. They have, again, full suite of products.
Facial scanner.
Facial scanner, yeah, it's a facial scanner. It's a very hot topic. And then this is the latest product in the photogrammetry world called the Shining Elite. So, Dr. Tawil, I want to let you take it away and explain. First, for those out there that don't really know what photogrammetry is, explain a little bit about what that is and what that does in the dental world. And then let's talk about this awesome new technology, intraoral photogrammetry.
Yeah, it's exciting to be able to talk about the technology, because we've been under wraps with this for so long, but from company directive to please keep this down so that others don't try to copy or anything like that. Everything always will be copied, and we don't want to release it too early. So it's nice to just be able to have this conversation with you, which is great. But let's start with what is photogrammetry. Photogrammetry is basically a system that is going to capture using basically known structures or mathematical objectives to be able to accomplish its acquisition. So basically, if you put something on something, it'll know the distance between the two because it understands the two objects that are known. And now we have the relationship of those pieces to each other. In dentistry, you utilize this in the mouth. Right now, there are several systems on the market. There are some that are good. There are some that are trying to be good, just aren't there yet. But there are some good, reputable companies out there that do a great job. And if you have a photogrammetry unit, you probably know what I'm talking about, how wonderful it is to be able to capture that implant capture. The only negative of it, number one, it's quite costly. And you do need to still use an intraoral scanner to be able to complement that. So your scanner doesn't have to be the best scanner, it has to be something good because you're getting your XYZ position with the photogrammetry portion. But we do want to be able to capture soft tissue, and then that has to be matched together in a separate software. And that matching part, there could be some errors. You could have some slowdown and turnaround time. So it is nice if we could get rid of that step, and it looks like we have. So photogrammetry is basically extraoral capture currently using a machine to capture known structures that we place on the multi-units in the mouth. These can look like flags. They can look like dominoes. They can look like a scan body with an angle on like a triangle with some markers on it. There's several different companies that have different types of shapes. And the purpose of that is to capture it all together. Now, if you have some pterygoid implants in the back, for those of you who have tried to capture that with photogrammetry, you know how difficult it is. So we want relationship to each other. Sometimes we have to remove scan bodies just to be able to capture those in the back. And you have to hope you have some implants in the front to be able to get those coordinates with, to be able to do the alignment. So we were looking for a solution that doesn't require us to stretch out the jaws, the cheeks as far as possible to reach to the back of the mouth. If you have 4 implants, it's easy. If you have 8 implants, very hard to necessarily get all those dominoes all at the same time, or those flags all at the same time to match up. And they do take up some bit of space. So we looked for another solution. And what we did was we created a new technology, a new term, which we like to call IPG, intraoral photogrammetry. As I've been working with Shining3D now for a better part of a couple of years, we have this new initiative to try to be able to do something different. So we've incorporated 2 separate cameras into one intraoral scanner. The scanner is very light, very ergonomic. It's very comfortable to feel in your hand. It's the fastest scanner I have used. It is the fastest scanner on the market currently. And I'm saying that as of today.
Right.
Tomorrow, someone else will come out with something new. That's the way things work.
Yeah.
And the other nice part is it's affordable, extremely affordable. What we do with the intraoral scanner is they sell the intraoral scanner along with a coated scan body kit. Just like with photogrammetry, they come with pieces. So you may buy a box of 8 of your certain scan markers. That box of 8 only works together. You have to know that those 8 are together. They work with each other. Same thing here. We have a scan box. We have one for Nobel, one for Straumann. We have one for the Megagen S-type, one for Dentium. We're working on many others. And we are compatible with the Nobel and Straumann systems, which is the main 2 within the US. And what we've done is create longer type of scan bodies, just like Archbridge in that sense. But here we want to have all of them pointed in towards one center. So we may have, let's say, 4 implants, where 2 of them are going towards the middle, and then the front 2 are going towards the middle as well. And the key with the intraoral photogrammetry is we are going to scan and overlap as we go by, just like we did with the Archbridge. We start with the scan body. We want to walk over with the new wider 19 by 14 window that we will then go over. And as it overlays from one scan body to the other, it'll automatically import those scan bodies into the software. Now, the beauty of having the intraoral scanner and the photogrammetry scanner in one handheld piece is, if you look at the workflow, we scan the soft tissue, or if we're in the middle of surgery, we scan the teeth and, let's say, a marker of some sort, so we know where, if we're doing some bone reduction, where we're going to be at. And we can then scan that initially. If you're using a Chrome case, having a combi guide, let's say, and not necessarily doing the actual luting in the mouth, you want to do a printed temporary instead of a luted temporary. We can scan to the actual combi guide. It can be metal, it can be resin. We can scan to that as our known structure. We can do our bone reduction. Now capture that intraoral photogrammetry scan bodies, and then match that either to the healed case to the tissue, or in a surgical case to our fiducial marker. So in that case, it would be to our Chrome guide, which we would then match up. We do 3 separate overlays of that, where it matches, let's say, the left side, the right side, the middle. They all match. We'll get, just like we're doing bite registration for occlusion, in a similar manner where it links up. And then we can go and remove a lot of the legwork that the lab technician has to do, matching the scan bodies to the actual photogrammetric bodies that normally happens after, when you use extraoral photogrammetry. So we've removed that completely with something called intraoral scan matching to the photogrammetry scan bodies. That's the beauty of having this 2-in-1 system.
Yeah, and that's on the lab side, everyone wants a faster turnaround time on their prosthetics so they can start printing in office. No one wants the patient, if you're loading that same day and not having them come back the next day, they're sitting in the chair waiting. With all the other options out there in the photogrammetry world, that designer has to import everything separately and then match it all up. With the Shining3D system, with the Elite, it automatically does it. So once the lab receives those files, the designer, they're starting to design right away. So
I do want to stress one thing with that, though. It's important to have the right designer, because as I've been experimenting the last 6 months with this and trying to educate labs, it's funny how there are a lot of labs out there that are, or I shouldn't say it as labs, there are people out there in general in the world that are kind of one-trick ponies. They only know how to do one thing, and they do really good at that one thing. It's important to make sure that who you're working with this, that they're able to handle all the different cases. It's one of the reasons why I've been working with Guided Smile and with Ro for so many years, is because I can throw any case at you and you guys can figure out how to work through that case, as we've done over the last 6 months of testing with this device and coming up with the new workflows for this device. So being able to open the files, being able to understand what you're looking at is important. Being able to make sure that the library is built. Ro has a very nice library. I'm sure if you were selling it, people would pay a pretty penny for Ro's library that you built over the last several years to be able to populate in, so that everything does open up properly, no matter which file I send you. I made mistakes and sent the wrong scan body file over using this system, and yet your team is able to rematch because they've been there and done that before. That happened, a year ago with another guy. Don't worry about it. We have the patch for that to work with as well. So being able to populate is great, as long as the library is there, and having the right lab to partner with to do that is very important. And that's why I've been working with you guys exclusively from the beginning of this to get that going, so that, because you guys do understand the file. So even if you may have purchased the scanner already, it's important to make sure that your lab understands that part. Ro does know that part very well, which is great, and can handle pretty much any pitch that comes their way. Whether it's a curveball or it's a straight down the pipe fastball, it's going to work. And that's key. And when you're dealing with these quick turnaround times, I really like that 1 hour turnaround time to be reduced because I have a patient sitting ready to go. So if I get you the records in advance properly and I'm on time with my surgery and your lab tech is sitting there waiting for me, more importantly, Andrew Pinney is sitting there
Right.
waiting for me to send over files. He's able to open it, populate, and get me a design even faster. And using the printer from Shining3D, we're using the AccuFab cell, we can print the full arch in under 15 minutes.
Yeah.
So we don't have this lengthy time. We don't have to bring the patient back the next day. We've shrunk that time down. We're able to be able to coordinate the time properly to where the patient doesn't have to wait long for their temporaries and gets a really nice printed set instead of a luted set in the mouth.
Yep.
There's nothing wrong with luting. I'm not telling you not to lute, but the advantages that come along with printed trying outweigh the other ones. With the luting together in the mouth, you really should have the backup done. We like to do that extra one because we do want to have the rapid appliance as our final. If you're going with if you're a Chrome guided smile doctor,
Yep.
you're used to making the rapid so you can finalize your case easily. But along the way, that temporary has seen some work. So the rapid is not necessarily representative of the bite, of the additions that you may have added to it, or the customizations that maybe you had made. With a printed try-in, we can take the printed try-in. If we're not happy about something, if the midline was off a bit, we can just scan that, send it back to the row, and more specifically again Penny, and
Right.
and tell them, hey, move it over a couple of millimeters. And sometimes I don't even have to scan. I can just say, just move it 2 millimeters over to the left, and it's done that way. And I'm already printing again. So it's a wonderful thing. And think about the fact that if a temporary breaks, because Lord knows that a lot of times you have these patients that disappear for lengthy periods of times. Maybe they don't want to finish paying their bill yet, and they're in hiding. Right. Hopefully that's not the case for you. Maybe it's just the fact that they may have had some medical condition sometimes. That things happen, life happens. Things get in the way. They may have a lot going on and they weren't able to come get you. And then all of a sudden at the worst time, they break their temporary. If you can reprint that same temporary, and in our case, we're doing it with the wash and cure in under 25 minutes, we're all done. Patient can come in and we're ready to reseat. So if I have a patient that's calling me, they're coming from far away, I won't even wait till they get here to see what broke. I'll just print it in advance. Doesn't cost much.
Right.
The resin printer, the Shining3D resin, which is available in literally every shade in Vita, we're able to get that done very rapidly. I'd rather have the backup sitting here waiting for them. It's just a handful of dollars to print, and I can have it ready for them just in case something is really broken. I can take it out. A lot of times they come in and say something broke. It's really the screw access hole is just open and just needs to be reclosed again.
Right.
Other times they say, yeah, something actually broke. I feel something, and you'll look and there's a crack in the prosthetic. If that's the case, it's been a few months. Let's remake it. It's already made. Take that out. Put the new one in. Doesn't really slow down the day. We get to move along, and we don't have to worry about luting together with metal and resin to try to fix the repaired, or having to utilize our rapid appliance that was our backup. Now, what is our backup at that point?
Right.
We're already trying to get in and scan in and break out whatever technology you have to try to capture, so that we can try to get another temporary made, because we know if the first one didn't hold, maybe the second one will. What's going to be your backup? You always want to have that ace in the hole, that backup ready and waiting just in case.
Yep. No, for sure. And that's one of the, there's a ton of benefits to photogrammetry and the intraoral photogrammetry in this case.
Absolutely. Absolutely.
Yeah. And that one of them is that restorative. If something breaks, you can print another one right away. And I don't want to make this about the printer, but I had heard, from Shining that it's a very fast print, 15. I'm hearing this 15 minutes. Then Dr. Tawil says 15 minutes. I was trusting.
We're even faster than that.
Right. It's actually faster. I mean, it's amazing. It's amazing.
We can get faster. We like to say 15, but we have cases where we can get down to 10.
Yeah.
We're depending on the thickness of the prosthetic, obviously, but our average case is around 15 minutes, and some may take 16 minutes because you have a little bit thicker of reduction that maybe you've done. But we're getting some really nice results in that speed of printing. And then the wash and cure system is really nice because we actually don't have to get messy. We just take the build plate off of the printer, put it directly onto the wash, and it does a self-cutting mechanism where it drops it into the alcohol basin. It knows how much time, because it knows what you put in the printer. So it knows how much time to wash for. And then when we take it out of there, we can rinse it off, can put some glaze on it, throw it in the cure. The cure knows what you've used because each one talks to each other. So now it knows I need 6 minutes to cure or 8 minutes to cure, depending on what material we just used. and it knows that you don't have to program it in. It's already there for you. Just hit start and walk away.
Yep.
So the beauty of the system is really incredible, from everything from the facial scanner going through the intraoral scanner. If you're not into looking into getting into photogrammetry, if you're an orthodontist and you're hearing this saying, I'm just listening for fun, facial scanners are amazing for ortho. We're able to do that. We can do that with the scanner as well. The Aoralscan 3 is still an amazing scanner if you're not looking for a photogrammetry with the Elite. But with the Elite, what we can do is just outclass pretty much anything else on the market with both
Right.
intraoral scanning and photogrammetry, because it's an all-in-one system and it's affordable. It's just about $20,000, a little under $20,000 for the actual unit, plus the coded scan bodies.
Scan bodies,
And
right.
what's beauty about the coded scan bodies are each one are connected to each other, right? Every scan body kit, whatever system you're using, they all have to be the same with each other. So if it's one system and they use the dominoes, those 8 dominoes are linked together with each other. Same thing with these scan bodies, they're all linked together with each other. So if you want to buy another set, you can buy another set. Let's say you lose one, you can order another one. We could recode for you and still do it. You don't have to buy a whole new set as in other systems have. So we're keeping it affordable. It does come with, the scanner comes with a set of scan bodies that you can choose, whether it's the Nobel or the Straumann, you can pick it. And to buy another set is not astronomical, which is the beauty of working with Shining3D, is that they keep things economical and functional, and that we can have this all lapped into each other. So the facial scanner goes in with the intraoral scanner. It's in similar software. So when you open it up, it's there waiting for you to have all the information then shipped out directly in one button over to the laboratory. So I'll throw in the CBCT in there when I'm doing my planning with the facial scan, the intraoral scan, send it to Ro, get my planning done, get my design done, see the patient a couple of days later, set the put the implants in, capture it with the intraoral scanner with the photogrammetry, send it off to Ro, get the same day design, and now it's time to finalize. I take the soft tissue, do the photogrammetry one more time to confirm my new position that nothing's changed, send it over, go, if everything was great, we liked our temporaries, go directly to our final zirconia with the vortex screws, the grammetry screw, and place it in and have a very efficient workflow that is very competitive and financially doesn't break the bank.
Yep. No, that's awesome. And you know, I want to make it clear that, you know, the Elite, we keep mentioning it's one scanner, does both, you know, the photogrammetry and your standard 3D iOS scans. Just if it's just a crown and bridge case, you can just use the iOS portion of it. So it's not like you have to only do photogrammetry with this one.
It happens to be the best. Happens to be the best iOS scanner I've used. I mean, it's really incredible just because the ergonomics of it is amazing.
Yeah.
And on that, and then the second part of it has different size tips. So we have the small, medium, and the wide intraoral photogrammetry tip, so that can get those tough to reach areas, those wide areas to try to capture for those long distances. The workflow is really amazing. We can skip steps. We don't have to have all the steps. If you don't want to do the scan matching, you just want to do the photogrammetry only, we have those options. It's just a really unique system that is affordable and has been really well thought out to try to match doctors' workflows.
Right.
So we keep adding new workflows daily as we learn of more doctors' workflows. Thanks to Ro, that has helped us lead the way with that, because you guys really have seen pretty much every workflow that's out there. It's helped us incorporate all the different doctors' preferences so that we can utilize this for every case, for every patient.
Yep. And you mentioned that, you know, the software and the ease of that. And I was floored. I mean, I'm not the most technically advanced person out there, and just the software steps you through. It tells you your exact next step and what you're going to do, and it's a very easy, user-friendly software with the Elite scanner. And when you're doing your photogrammetry cases, I mean, it's, you know, that's one thing that the learning curve is. It's a very low learning curve, short learning curve.
Yeah, actually, it's funny. We're working with Shining3D. I mean, you know me already. I have about 15, 16 intraoral scanners in this office. I practice with my dad and an associate and 2 hygienists. And my dad has never wanted to scan. Every scanner I give him, I don't want to name names because I don't want to badmouth any scanners. There are a lot of good scanners out there. He was never able to scan until I gave him the Aoralscan. So it's when he finally picked up this Aoralscan. He saw how simple it was to use. And now with the Elite, I mean, it's just like basically holding a pen in your hand. It's just, it's amazing how nice and thin and ergonomic it is and lightweight it is. It uses the USB-C cable, so it's easy to use and can transportable. So if you have good computers that you can plug into, you can actually go from computer to computer with it.
Yep.
If that's something that you want to upgrade your office to, you just need a good graphics card with it, and you can be plug and play and ready to roll, or just put it on a rolling cart with a laptop or a nice touch screen. And they do have touch screens available directly from Shine3D if you want to purchase theirs, but you can make your own as well and just go from room to room scanning with ease with that USB-C portability. So it's a really nice, elegant system that's really thought of everything, and we're incorporating as much as we can before the official release, which is coming up. This might be airing shortly after that, but
Yeah.
it's been a fun 6 months of preparation with Roe building this, and it's going to be a really interesting year to see the technological shift that's going to happen now with an affordable alternative. I've already seen some social media posts out there that are saying, why do we need this for? Why are we doing more acquisition now? We fixed acquisition. We haven't fixed acquisition. If we fixed acquisition, something would have been there to do it. We're spending money and money and money to try to fix acquisition. If it worked for one doctor and they may teach their courses and teach others how to do it, and I've attended those courses, I've seen those doctors try to replicate that. It wasn't replicatable as they say. For some, it was. Maybe it's 25%, maybe it's 50%, but it's certainly not 100%.
Right.
This is something that is 100% repeatable for every clinician that's out there. And that has to be the key. It can't just be that you go to this course and I learn this method. When things change, how is that going to be adaptable? This is something that's adaptable, works for every system,
Right.
and everybody will get the same results. And that's the key. By not having to link wires together, by not having to use anything else other than just this intraoral scanner, no other systems, and not breaking the bank again on trying to outfit your office for, let's say, only a few cases a year that you might be using, or for a daily base case systems that you may be requiring something like this for.
Yeah, no, that's great. And just to summarize this product, again, it's a photogrammetry, specifically intraoral photogrammetry, and iOS intraoral scan in one unit. And like Dr. Tawil mentioned, I mean, it's ergonomic. It's one of the smallest footprints out there with the intraoral scanner. Very easy to use. The kit comes with the set of 9. I think we're currently 9. I don't know if you're going to expand, but right now it's 9 different size dominoes, the scan bodies, and their unique unique set of scan bodies that they have. And this allows you, again, to not have to switch back and forth to the extraoral photogrammetry camera. It's all in one. It's a faster workflow. On the design,
and the scan matching.
Scan matching for the designers. Again, working with Roe, we understand this software, and once we get your records, we're able to get to design faster because of the matching that the Shining3D software already does for the designer. So that huge benefit there. And then the turnaround time back to the clinician from Roe, from the lab, on your design, so you can get to printing faster. And then a lot of these doctors that are doing the photogrammetry, they have the patient come back next day because of the time it takes to get the designs back in the print. Well, some patients don't love that. With this suite of products, you might be able to capture back that same day immediate load without stressing out your team, stressing out the lab to hurry up with the designs, and then stressing the patient out waiting. I mean, this is because the speed of the printer with Shine3D, the stacking of the files, and the design time, helping speed that up. It's very realistic to get this thing printed and loaded same day a lot faster than the other options out there.
That's exactly right. Well said.
All right. Hey, I know that there's an entire suite of products, and this is a very cool, new, exciting venture we're going down with Shine3D with the intraoral photogrammetry. And I know that there are some things in the works. Is there anything you want to tease, or you're able to tease, for the doctors that are, if they get this scanner, is there something you can tease maybe, or maybe that's enough tease?
We have a few things in the work. So I guess we could spill the beans on one of them at least. One of them I think we gotta keep a little hush hush, but one of them that we're coming out with is, as we spoke about before, with the healing caps. Like, what healing caps do you use? And what we are coming out with now is a intraoral healing abutment that is that is actually coded as well. So it'll match the scan bodies that you're using in the system. So if you're using the Nobel, it'll match the Nobel scan body system. So that matching of the healing caps is now going to be eliminated as well. And we do not need the fiducial marker to match it to either. So if you're trying to match that last tissue scan, which is always the last thing, and the designer's like, yeah, I'm done. I'm like, oh yeah, I forgot. I got a 3-point match each one of those healing caps. Oh, look at that. There's 9 of them. Oh, great. That is now going to be replaced with our coded healing cap method. It is really remarkable. They do have a really nice shape to them as well. And we've worked on some other things, such as what we like to call the 4D bite, the photogrammetric bite. So we're able to capture both to the chrome bars. We're able to add attachments to that for photogrammetry using either the scan bodies or the actual coded healing caps. We can also use these coded healing caps. We can take out the screw and use those as fiducial markers by driving a 2mm screw through them and utilize those as markers. So we can do both iOS and photogrammetric matching with this system. So we're really trying to think outside the box with it.
Yeah.
As we get this into more doctors' hands, people come up with more ideas. Thus far, it's been a lot of our ideas, and now as we're opening up, we're getting a lot of outside input, which has been really beneficial and helping us to understand what else is needed. And the release that we have now is great, but I can't imagine where this software is going to be next year.
Right.
There is one other thing I can say is that Shining3D is coming out what they like to call the Sphere. It's going to be all the different systems in one: the desktop scanner, facial scanner, intraoral scanner, all the different Accurate software, the design, the printing, everything all in one. And it is all cloud-based as well, so we can access from your house. You can be planning, doing cases, working on them, and then shipping it to your printer, which could be ready to receive, ready to print. Ro will be able to log in and print from your printer while you're in the middle of the surgery. So let's say you're doing an upper lower, you scan the upper, you're ready to print. It could be already printing while you're working on the lower. All of these things are coming in the near future, and a few other surprises that we're working on that we're in the middle of patenting that will hopefully come out very, very shortly, hopefully before the new year, which is going to be kind of fun. So there's more and more coming, and the key to this is that it's coming and it's affordable. It's if you're looking to get another scanner, or if you weren't looking to get another scanner, it's still affordable. It's not something where you say, oh, I can't spend $60,000 now on this system. Having a backup scanner is always great. So if you have a scanner and you're looking to say, I do want a backup scanner, this will be your primary scanner. You can let the other one be your backup because it's going to take over your practice, and it's changing the way that we practice dentistry and full arch dentistry.
Yep. No, very cool, Dr. T. I want to thank you for your time, and what we're going to put together here at the lab here at Rowe in the Cleveland area is we want to do a live CE, a live well, it's a live course, I guess, on the whole suite of products and with the Elite, and doctors can get their hands on it. And of course, we want to have you here as well to go through that. So we'll stay tuned for the dates on a live CE course on the entire suite of the Shining3D products, including the Elite, because again, I know everyone's going to want to get their hands on this. So we look forward to working with you on that and all this fun, exciting stuff in the future. And again, thank you for your time.
It's always a pleasure.